Beacon's role with regard to advancing bladder cancer research has really been to act as a facilitator, to bring together the physicians, the clinicians, the researchers at the various institutions all around the country who've been dedicated to bladder cancer, to bring them together, have everybody in the same room, and talk about how we can work together to move the field forward. I think an important role for patients and caregivers as advocates is to raise awareness about bladder cancer. So many people, in fact the majority of people who have been diagnosed with bladder cancer will tell you, I never heard about the disease until I was diagnosed. And we all know that educated patients make good patients, and education and awareness leads to better prognosis. Better prognosis leads to better outcomes. There are a variety of groups that are involved. There are patients, there are doctors, there are researchers, there are payers, there are medical institutions, there's the government that sets health policy. So there are all these varied interests, but really at the center of it is the patient. And the patient's voice needs to be heard. We haven't had any treatment advances in nearly 30 years, and that's unacceptable. And anybody who's been diagnosed with bladder cancer just needs to get up there and say, this is unacceptable, we can't take this anymore. It's really time to devote the resources and the energy and the brightest minds to finding better treatments for this disease and to find treatments that save lives. I see us working together, all of these institutions with Beacon, working together in a number of ways. One is in education. We can work together and provide educational programs for the patient populations in each of the medical centers, because I don't think there's such a thing as too much education. We need to raise awareness about the disease. We need to educate people, both those who are living with the disease, but then also those who might not know anything about it, but people need to know about the risk factors. They need to know about the signs and symptoms of the disease. And that's something that's perfect for an advocacy organization like Beacon to partner with medical institutions like Hopkins and others to be able to move that forward. And in the field of research, again, it's getting the word out. When you have research grants that are available, you want to be able to solicit applications from the best and the brightest all around the country and indeed all around the world. The Hopkins Greenberg Bladder Cancer Institute is a wonderful development. It's an incredibly exciting development for the bladder cancer field. It gives us a recognition and a credibility that is very much needed. It will work as a place where, again, the researchers can work together to help advance the field. It's just incredibly exciting that this large resource is devoted to bladder cancer, because it's exactly what we need.